I know that's there's something on tonight that I'm hoping it doesn't compete with this, but that's the way it goes sometimes, is picking and choosing what works best for you. So anyway, thanks for coming tonight. We have Heidi Hotvedt joining us tonight. She's joined us for other events, and she'll be joining us for future ones as well. She's the child care nurse consultant from Healthy Child Care Iowa, out of the Iowa Department of Public Health. So we're glad that she can be a part of this and help us get through some of these questions and figure out what we're really needing to do within our businesses for COVID. So with that, Heidi, I will let you start.
Great, thank you so much. I'm just going to go ahead and advance my slides, so hopefully everyone's seen my slides. My name is Heidi Hotvedt. Like Terry said, I'm the coordinator for Healthy Child Care Iowa at the Iowa Department of Public Health. My contact information is here, so both my email, and for some reason my email is not linked, but that's the email website here. I can just point to it. Sorry about that. And then my phone number, you can always call, and if I'm in a meeting or something, leave a message. I'll give you a call back. I know sometimes it can be frustrating when you email and then you don't hear back right away and you're trying to get a question answered. So feel free to call me. And also, of course, you have your local nurse consultants that you can always reach out to too. So, and if I can't help, sometimes they can. If they can't help, sometimes I can. So, so we are here to help you and kind of work through kind of all these kinds of questions that we get through through the pandemic and just in general too. So, and then our website, of course, Healthy Child Care Iowa. Okay, I'm going to do a few, just a little bit of overview, and just wanted to talk about a few things that seem to keep coming up as questions or emails that I'll get. And so I just wanted to make sure that kind of everybody's on the same page. So we do have 2 guidance documents that Iowa Department of Public Health and Department of Human Services have worked together jointly to provide guidance for child care providers across the state. And the first one here that I want to just talk about, well, I'll mention both of them. So we have the child care guidance. The most recent update was August 13th. And then we have a case reporting and outbreak response guidance document, and that was updated August 6th. So they've been on the websites for about a month to 5 weeks, but they are still active. Those are still our current documents, and we've had some questions about that, wondering if we're going to be updating. We really follow the Centers for Disease Control information that comes out, and sometimes there's a little bit of a lag. There might be a change on the CDC website, and then it takes us a few days to get something out or to make a decision if we're going to follow that specific guidance or to make any changes to the guidance documents that we have. So we try to stay as up to date. I'll tell you, the first thing I do, it seems like, I don't know why, every Sunday it seems like they want to post something updated, and then Monday morning the first thing I do is check everybody's websites to see if anything's changed, because you would think I would be in the know. I am not in the know. Sometimes it's like, oh, I didn't know that Iowa Department of Public Health posted that. Sometimes I get a heads up, sometimes I don't. That's just how it goes. So I would just recommend to all of you to really just continue to check the CCR&R website, the Department of Human Services website, and the Healthy Child Care Iowa website for updates, because things do change. So we try to keep those all up to date as soon as possible. And then I just want just to kind of share, so we have a guidance document that covers quite a few things in terms of health screening and face coverings and social distancing or physical distancing, and some of those important guidance recommendations that will help to mitigate the spread or the risk for infection from the COVID virus. But we do know, and I just wanted to kind of start from the beginning, is that at this time, IDPH and Department of Human Services are not making any changes to our guidance document, and we are aware that unfortunately they do not quite align with the school Department of Education guidance document that came out before school started, and some of you might have already seen that, so that's why I'm bringing that right off the top here as something I want to address, because we've had a lot of questions about it. And it is challenging when we're not all in alignment, but I think there's a reason for that. For one thing, we've been, consistently using our guidance documents and keeping those up to date since March. And with schools reopening, they were looking at how are they going to have their guidance. And they're really looking at, how does it work for the school district itself. So, some school districts are requiring face coverings, some are not. We are still encouraging staff and school-age children to use face masks or face coverings while they're in care, but we're not requiring it, so that doesn't really align. But I go back to say, if your school district is requiring it, maybe that's something that you would just go ahead and institute in your program, just because kids are getting used to wearing them anyway. So we might as well just kind of follow along with what the community is doing. But every community is unique. And then the other thing that's really not aligning well is the school programs are looking at things a little differently in terms of exclusion. And that's I think a part of that is just that school districts are looking at things a little bit differently in terms of health monitoring and exclusion. They have a school nurse on staff, where with child care programs, centers, and homes, you have access to the health consultants and to our nurse consultants across the state, but you don't have someone in-house like the school district does, so it's a little different. And then also physical distancing and spacing of children is I'd say not easy, but more realistic in the school setting, and because kids are older and you can space their desks apart and you can stand apart from the group and not be giving hands-on care. You're not helping school-age children usually toileting or eating or with needing some just a hug and a warm lap to sit in when you're reading a book, and all those things that we want to continue to do with the children in care. And that's challenging, and we know that, and it's just really developmentally not appropriate for infants and toddlers to be physically distanced from their care providers. I mean, we know that's really not possible. So I think that's the big, there's kind of a difference when you think of school age and you think of older children, and some of the mitigation strategies that schools can use that really are not as much of an option in the child care world. So, so just so you know, we are aware they don't align. We kind of, we had some conversation about could we have more alignment, and there may be a change that will come, that we will be more aligned. We do know that parents and providers are a little frustrated, or have had some frustration because they might have a child who say is excluded from childcare but not excluded from school, or vice versa. So it's confusing, especially for parents when they are looking at our guidance documents. But we would just encourage you to continue to follow the Department of Human Services guidance documents and our IDPH guidance documents to make sure that we're keeping kids healthy and safe in care. A couple of things I just want to highlight on here. So, like I said, face coverings are encouraging them for staff, for childcare provider owners, and school-age children. And you can go as young as age 3. It's really challenging when you get, that we can have, CDC does say, 2 and above, you can or above age 2, you can have a face covering. Younger than 2, you do not want them to be using a cloth face covering. It's not safe. I would say sometimes it's harder with those younger, 3-year-olds to have them wear face coverings, but something to work on. And kids are really doing a great job. I think that they're they're used to seeing, their own family members maybe are wearing them. They have older siblings that are putting their face masks on or face coverings on, and so it's getting more, routine, and so maybe not as concerning, or maybe not as resistive as more children are out and about in the public and seeing people with face coverings on. And there are some great resources on face covering. So I would just really encourage you to go to the Iowa Department of Public website on face coverings. I mean, there's a whole page. There's, how to work with children about it, how to sew your own, how to clean them. There's a lot of great information on the website. So I would refer you to that. Like I said, physical distancing, Department of Human Services is no longer recommending limiting, group size. Now, with home providers, you have your ratios and your group size already. So that's not as much of, in terms of regulatory changes. But, it's challenging to physical distance 6 feet away. I don't, I think in some settings that might work. I just think that would be a challenge. So that's something we do recommend, because we know that if there's a positive COVID case, then we always look at who is the close contact with that child. And if you're, within 6 feet for 15 minutes at a time, then you're considered a close contact with that person who's positive. So, if you can physical distance, or if there's things that you can do to be more physically distant, depending on your size, if you're, I know of a couple programs, category C, where they kind of have more of a layout where they have separate rooms. If there's something that you can do with that to try to keep the older kids or the school age kids away from like the infants and toddlers. I mean, there are some things, and every situation is very unique. So I would just say reach out to your CCR&R consultants, because they know your programs. They can help you with that policy and try to help you, kind of work through that. And that's a really good opportunity to connect with them. Keeping groups static, I would say probably, the home providers do a great job with this, because you're used to keeping your group static. You're pretty static. We do have more of a challenge with that in larger programs, because we have sometimes where there's, part-time staff or different things like that. But I'd say in general, that's probably not as big a concern for you all, because you keep your group static, most of the time anyway. I would say just, we are limiting visitors. I do know that Department of Human Services is starting to make visits. I know that our child care nurse consultants across the state are starting to make on-site visits again. Really, we're still trying to limit not being in the physical space of the children and maintaining 6 foot distancing. But that doesn't mean that we're not here to help either. So there's a lot of things we can do. I've been talking to a couple of our nurse consultants, and I know a couple of them recently did child record reviews. One of them did the child record review in their car. The provider set it in a box outside the door, and they went and picked it up. Another nurse consultant went and sat in their backyard patio area and did it at a table outside, and they did not have any interaction with the staff or with the owner or the children. So they were able to do the child record review, and then they actually did a virtual visit follow-up, so they could virtually over Zoom, talk back and forth and have some discussion about some of the things that are needed, because that's really hard to do in emailing. We know that to try to email or even on the phone, it's really nice if you can show what you're talking about. So just so you know, we're here to help. And then we do have in that child care guidance is, if feasible, to continue that health monitoring, or having parents, kind of self-check. But really, best practices, if you can continue to health monitor, and by taking temperatures and monitoring for signs and symptoms of an infection, any concerns about exposure, asking those questions like, has there been someone in the home environment that has been exposed to COVID-19, or is in quarantine right now, or is waiting for test results? I mean, those are key things to ask, so that you're not, allowing that child to come into care, because that is what puts an increased risk then on your program if there is a positive case. So in general, DHS still says in their guidance document, if children have a parent that are ill at home, they should not be in care. If children are ill, they should not be in care. So they're pretty, that's been working well for us, and I would encourage you, if feasible, to continue that health monitoring. And then we really just are continuing to say that symptomatic staff childcare provider owners and children should get tested if they have symptoms. Overall, the Test Iowa, you are listed as a priority group. So if you fill out the information on Test Iowa, you will get a prioritized in terms of having the test results or to be tested through Test Iowa. It's free, and we really just see, if you're symptomatic, the guidance for children and staff is if you're having symptoms of COVID, you should be excluded for 10 days. 24 hours fever free and symptoms have resolved. So if you're symptomatic and get tested and it's a negative test, then that does allow the child to come back into care and not be excluded for as long a time period. So that is just something that we would encourage you to do. And we can't force, parents or tell them they have to test, but I think that is something that's important for us to share. I'm going to just keep going to my next slide. So I just mentioned this, but about having symptoms, that CDC isolation rule is that if you have tested positive for COVID-19, or if you have symptoms and you and you are excluded from care, that you need to follow that isolation rule, which would be at least 10 days have passed since the symptoms first appeared, 24 hours fever-free without fever-reducing medication, and symptoms have improved. So we kind of call it the 10-24 rule, or the 10 one-day rule, fever-free. But that has not changed, and so we're continuing to provide that guidance until the Centers for Disease Control changes that. We will continue to provide that. We get this question a lot. So if a child doesn't get tested but is having symptoms of COVID, say they have a sore throat, they have a fever, they go in, the physician does a strep test, and maybe it's negative or positive, it doesn't really matter. If it's positive, a lot of times they'll be on antibiotic. In the old world, before COVID-19 and before our pandemic, we would have said once they're fever-free and have been on the antibiotic for 24 hours, they could return unless they're having other symptoms or having excessive drooling or concerns that you can't manage their care. That is not what we're dealing with in the COVID-19 world right now. That we need to really think that if the child is having two symptoms that are listed, if they have a sore throat and they're going in for a strep test and they have a fever, that it could be COVID-19. And so without testing, we're not going to know that. Just encouraging parents to understand that if they have any of the symptoms on the list, that really best practice would be that they would get tested, and then be able to find out what their test result is before you would determine when they would come back into care. We do have our case reporting and outbreak guidance. That's another DHS IDPH guidance document that was created, and that guidance document has continued to work really well for our state. So when there's a confirmed COVID-19 positive case, and so that's confirmed positive, not just symptoms or not just pending results, or the person thinks they have COVID-19. It's when they actually have a confirmed positive COVID-19, either in the staff or the child care owner director, or in a child, that you would report that to Department of Human Services, to your regulatory consultant, and then they or you or all three of you will work together with the local nurse consultant, and then the local nurse consultant will reach out to local public health to let them know that there was a confirmed positive case, and kind of give them a heads up that this child is in group child care. Local public health then will do a contact tracing. Some of the public health agencies either do that themselves, or they have state Department of Health sometimes helps with contact tracing, so it might be state or local. But that contact tracing then is done, and it's great to always have that communication ahead of time that this child who's tested positive, we just received notification from this child care provider that a child in care has tested positive, and so they're needing some guidance in terms of quarantine of close contacts. And so that when there's one confirmed case or two, then that's the protocol. When there's 3 confirmed cases within a 14-day period, so we always look at a 14-day period of 3 confirmed positive cases in staff or adults in the program, then that's when I actually start tracking it. I'll be honest with you, we haven't had a lot of home providers that have had outbreaks, what we consider an outbreak of 3 or more. More centers, of course, we think about bigger numbers, but that is something that I will track and work with state and local public health to make sure that we're that we know, what the close contact kid who was affected, what kids were affected. If it involves the family, that's another challenge. Is sometimes it doesn't involve the whole family because the program maybe when older kids come home, they're around the children or they're all at a table together, and so then they would be considered a close contact if they were within 6 feet of the children or the child that has tested positive 6 feet for 15 minutes. So that's, I guess, my next thing I would say is if you have family members when they come in for the day, have them socially distance from the kids in care. It's just another mitigation strategy to try to help to not have your own family become those close contacts and to help prevent the spread of infection. But it is, it's not unusual that sometimes happens. And then, of course, the biggest challenge I think for home providers is that you would be considered a close contact, so you need to quarantine for 14 days, which means you won't be able to do care for 14 days. And it could be longer depending on who that close contact is and the last time you were actually in close contact. So sometimes we've had this happen where it's been, actually had a provider who had called me and was really, she said, I'm going to do this differently next time, but it was her, her own family member who happened to be in care and exposed kind of the whole group. Well, then she didn't socially isolate from that family member. I mean, and sometimes you can, sometimes you can't, because the children, it's your own child and you need to care for them. But so then it just prolonged it because they had to actually, once the child no longer had the illness and they were clear, it had been 10 days. And then the 14 days started after that last contact with the child. So once they were no longer ill at 10 days, then they had to go 14 days from that. So it ended up being 24 days of quarantine that this provider was needed to do. And that was really frustrating and challenging for her. So the CDC does have some quarantine scenarios with calendars actually on the website. And I have the link right on there because I use this all the time. And I'd say, if you have any questions, look at this, look at these quarantine scenarios, because it does kind of show that sometimes when you continue to be in close contact with someone who's positive, how long that actual quarantine might go out for longer than those 14 days. So if you haven't seen those scenarios, I would encourage you to go on the website and look at that.
Heidi, we do have a few questions. I don't know if you want to take a couple.
Yeah, I can take them now. I was just gonna, go to kind of the next topic. So.
Okay, well, the first one is, what should we do when the doctor doesn't feel the need to test? And if you need more clarification, I can always unmute.
Oh, well, and we actually have had that scenario quite a bit, actually, where we've had parents or physicians say we don't want testing done. So if they're not tested, then they have to be out the 10 days and the 24 hours fever free. So so it'll shorten their time out, their time of exclusion, if the parent requests and asks for that test to be done. And even if the physician says, I don't think it's necessary to test, I don't think the child has COVID-19, even though they have some symptoms, that the parent does have the right to ask and request that a test be run. And I will tell you, I have actually talked to a couple different providers just recently, because we have influenza season coming, that they're going to be doing kind of a triple test. So if a child comes in and they have a sore throat, they have a cough, they've got cold symptoms, plus a fever, they're going to do a you know, a strep test, a COVID test, and an influenza test, kind of do all three to help rule out what they actually have. We know that with influenza that if they have influenza, then we do, there's medication they can take if it's within the first 72 hours of them having symptoms. So there's kind of a clock that's ticking that if you don't go in and get seen right away, then you kind of miss the opportunity to take the Tamiflu, which can be really helpful for so that you don't have a severe illness, you know, with influenza. And then, you know, if it's not COVID, then they can come back sooner, which is another benefit, you know, if they're negative. So I would just say, you know, that's something you could look at your policies, work with your child care nurse consultant on developing a good policy for your families right now. You might have always had an exclusion policy, but you might want to just ramp that up and just say during COVID-19 pandemic, this is what my policy is going to be. And I would encourage, you know, parents to have their child tested. So good question. Is there another one? Okay.
Yeah, there's one more question that was just posted. Let me scroll up a second. So can people get tested too soon and then get kind of a negative? But if they would have had, you know, symptoms and test negative, but actually maybe if they would have waited longer, it would have been a positive test?
My understanding, and I'm not the expert in this area in terms of those windows of testing, but I do know that if you're having active symptoms, that they usually will run the test, and if it's, you know, they'll do a PCR test, and if it tests out negative, then they feel it's, you know, a true test, or if it tests out positive, it's a true test because you actually have active symptoms of COVID. It's it's much more challenging if you're asymptomatic, where you don't have any symptoms and you're going into testing because you maybe think you have COVID or you were exposed to COVID, because there is a window when the disease you actually, you will have the virus present in your body and you'll actually be shedding that virus. And they say that's like 48 hours prior to the symptoms developing, and then it lasts through a period of time where you can shed all the way out to about 10 days. So there is kind of that window, and that's why we exclude for that long, for one thing. And then also, that's why sometimes that testing, if you're not having symptoms, is kind of, you're not sure where you're at in the possibility of viral shedding. So that if you have symptoms, it is best to go in and do, and either the Test Iowa site, they'll actually, and I'm not sure how that works, but I know if you enter the data and then they'll ask when the symptoms start, it'll give you a ticket of when you need to be tested. So it might not be that day, but the next day, depending on that symptom start date. So good question. Anything else right now? Okay, good. So I just wanted to say, you know, I talked about our Healthy Childcare Hour website. We do have our website, and the link is up here in the slide. But we have kind of on the side, we have a bunch of tabs. So if you clicked on the Child Care Nurse Consultant tab, you'd be able to go to the find your local child care nurse consultant, and you'd be able to see the map and the contact information. And then my information is also on there. So so if you needed to get a hold of me and you can't remember what my contact information was, you can always look there too. We have some other tabs. Child safety is on there. That kind of connects with some of the Consumer Product Safety Commission information. We have a tab on child care screen time and physical activity. This tab is actually really great. If you haven't been on our website, the Consumer Product Safety Commission Food and Drug Recall Products tab. This is actually where you can click on the CPSC or the Food and Drug Recall link, and you can actually sign up to receive those into your email box, which is really nice. If you haven't done that before, and there's actually there's a third one on there. It's a recall for through the National Highway Transportation, so for recall car seats. So you can sign up for those listservs, and the links are right there on the tab. So if you are interested to go on our website and look at that, you could do that. But Consumer Product Safety Commission is great to be on that listserv. So you'll actually get an email in your email box if there's been a recalled product. You can choose children's products so that you don't receive everything. Because if you say recall everything, you'll get recalls of everything, including, you know, everything, yeah, like ski equipment or, you know, or some kind of power tools. They're just, you know, there's lots of things that'll get recalled that you can choose. You can narrow that search so you only get the recalls for children's products. And then there's the tab, the Find Child Care. Of course, that's going to direct you to the Child Care Resource and Referral and to Department of Human Services. So, and then our printed product page, and that's our tab that has kind of all of our printed products, a lot of our forms, a lot of the helpful fact sheets that we have on safe sleep, and the information on medication administration, and just a lot of different fact sheets are on there, and handouts. So, and then some of our care plans for children that have maybe asthma or food allergies or whatever, all of that is on there. But we also have a COVID-19 section, and we kind of put it in this area, even though unfortunately I could not add a tab to our site. So I had put it somewhere where I thought people already had bookmarked printed products. So I decided to put it in that section. But if you just scroll down to the COVID resources area, then you'll be able to see all those links. So that's on our website. And there's some different guidance links and documents on there. I'm going to change topics a little bit and talk a little bit about storm damage and health concerns. And this is an emerging issue. So you're the second group that's getting information on this, to be honest with you, because it was brought to our attention kind of over the weekend. I actually received a phone call, an email and phone call from a provider that was having some real concerns because the provider had previous storm damage on her childcare business with a tree limb had fallen on the roof and had done some damage. And then over the weekend, because of all of the rain we had last week, she had some additional storm damage because, you know, her roof had I don't know, tarped, you know, so then she had water coming in. And so she ended up with some water coming in and had contacted us. Well, then since that happened over the weekend, I actually had received some additional emails then on Monday and reached out to, and then Mary Jansen actually from CCR&R Region 2 actually reached out and had also had some concerns about this because of some things she had been hearing from the field. So I reached out to Ryan Page from Department of Human Services and just kind of to let her know what was going on and some concerns. And so she had asked if I could work with Child Care Resource and Referral, and we could get something out through a constant contact to talk about some resources for storm damage and health concerns, and then also to put it for a Facebook post and a blog. So you might be getting that tomorrow. I kind of finished that up today, and it's in the work for being approval. There's always a process for that. But so pretty much the three things that have come to our from the field is the concerns about mold, lead paint, and asbestos. And so just wanted to talk about a little bit about that. So I think what's happened is, and we've known this from when we've had flooding in Iowa, whenever you have water damage, or you have sitting water next to a foundation, or you have water that seeps in through window wells, or you have standing water around your exterior of your home, or in a kind of in a corner, maybe in a low spot, you do have the risk for mold growth because high humidity, mold spores start to develop, and it can happen very quickly. I mean, anyone who's on the call today, if you've ever had water in a basement or you've had water sitting somewhere next to your foundation, it's kind of shocking how quickly mold will start growing. And because we're having warm weather, we are already seeing that. So that's something that just for you to be aware of. If you have had some water issues, mold is a real health concern for can be an allergen, and then it can also exacerbate asthma. So children that have asthma may start developing some symptoms because of increased mold spores that maybe the person, in the room maybe doesn't even realize or hasn't even had any problems, but the child is having some problems with their asthma. But it can affect, it doesn't matter what age you are, mold spores can cause some respiratory issues, and does need to be cleaned up. Lead paint is the next thing, because when window wells or window sills have been wet, or if maybe there's some water damage and and maybe you have some wet ceiling tiles, and you have some areas where some things have to be fixed or cleaned up. If you have concern about lead paint, and I know that's something that as providers that you're assessing for lead paint, that's something that's part of that DHS regulation, is to assess for lead paint. But what happens sometimes is you maybe have no issues with lead paint, and you might have a home that's was built or a facility that was built back in maybe the early 70s, and you've never had any issues with lead paint because your paint has all been intact, it's all looked good, you keep up on keeping everything painted well, and you don't have chipping, peeling paint, and then all of a sudden you have water issues where that moisture happens, and then what happens is the paint starts to peel, and then those under layers possibly could have lead paint. Or if you have to rip out any sheetrock, drywall, wood trim around, or painted trim around your window wells, around your baseboards, any of that, around your ceiling tiles, removing that could expose lead paint. So that's a concern, a health concern. And then the last one is asbestos, and this one really asbestos can be in a lot of products. That's limited now in building supplies now, but in the past, building supplies included asbestos a lot of times, those asbestos fibers, and so that is concerned, especially with ceiling tiles, sometimes floor tiles, and then stuff that like insulation in your attic and some of those kinds of things. So asbestos is also a concern, and those are some health concerns that I just want you to be aware of if you have had some storm damage, or if you're noticing that into your home environment, and that you would really want to do some repair and do that safely. So I'm just going to show you a couple resources here. So the Iowa Discovery or Disaster Recovery website has some great resources available on their website, and then links to other places. So if you haven't been on their website, it's specifically related to the storm from a month ago, and then they have some helpful resources. They've got news and updates. There's a Facebook page that under the community, I know in a couple communities they have Facebook pages where they're actually posting things that are some resources. And I know CCR&R has been really actively involved also in this. So just so you know that website is a great place to go if you haven't been there. And then right on that website is the FEMA information. So I know that that's been a question that, maybe in the initial storm damage, you didn't need FEMA, but now you've got water damage and maybe you need to be talking with FEMA. So because the water damage is as a result of, that you didn't have your roof, you were waiting for your roof to be repaired, and so you had it tarped, and now you've had water coming into your attic and it's ruined your ceiling. So I mean, there's some things that FEMA maybe could help out with that you might not have thought about at the beginning, or didn't need to because your insurance was covering it. So so definitely this is a great website. And then also I wanted to just share some other resources specific to the mold, the lead poisoning, and the asbestos. So the CDC has just kind of a general link for disasters and severe weather. So that's a really great website to just go through, and they have some resources on that. But specifically to mold and cleanup and remediation, this is the link on this site. And I don't know if this is something that we could send out maybe after the presentation. This is part of this is some of the resources that will be going out, I think, in the constant contact, but like I said, it's being under approval right now. So but if there's something that you need to look up, it's here. There is a really great fact sheet also of clean up safely after a disaster, to make sure that you're using safe techniques and not putting your own health at risk. The Iowa Department of Public Health has a childhood lead poisoning prevention website, specifically for children, but there's just some general information about lead poisoning. And then if you click on property owners on that website, there's specific information regarding lead issues, and if you're doing any kind of cleanup or repair, so that you're not spreading lead into the environment that the children are in. And I think I actually, in my previous role, when I worked in Minnesota, I was the lead nurse for our county. And I'll just tell you that I had no idea until I was doing lead inspections and following up from children that had had severe lead poisoning, how quickly and how easily lead can spread in an environment when you're doing repairs. And something as simple as, you have some chipping paint and you're going to repair it and you don't realize that it's lead. And then just by dry sanding, how fast those lead particles can actually float around on other surfaces, get into air ducts. There's a lot of really, I've had, just some experience with that lead poisoning, that it can happen very quickly for children when they're exposed to lead. So that's a really good website if you've never looked at their website and looked at that information. And then asbestos is a little challenging, because if you have asbestos, you really need to be using a professional would need to be involved. But the Iowa DNR does have some information on asbestos information, specifically around disaster like debris, like when you're doing cleanup or you're trying to pull out, you pull out some walls or some sheetrock or whatever. They have some really specific information on that. So that's a good website to click on and then look at that information. It's going to direct you to, if you have concerns about asbestos, that you should be working with a professional contractor who does asbestos removal, because there's actually a process for that. They need to seal things off and make sure that those particles are not floating in the air. We know that, like I said, mold, most of that is related to respiratory issues. Lead poisoning can affect, it affects many organs in the body if there's a lead poisoning exposure. And then asbestos, there is concern for leading to disease of the lungs or even lung cancer. So that's a concern. So I just wanted to share those resources with you. And I know that people, on top of having COVID, to have damage in your home or business is so frustrating. So I know that CCR&R had originally done a survey to talk with providers about potential damage. If you maybe had filled out that survey a month ago and your damage, you had some tree limbs down and that was it, and it wasn't any big deal, but the tree limbs maybe took off one side of your house's eaves troughs, and now because we had rain all week last week and you weren't able to get that fixed yet, you've got water now in your basement and now you've got problems. So I think reaching out to your local community resources, and then also to CCR&R to kind of help steer you, and to your local public health or your nurse consultant, and she can kind of connect you maybe with some local resources, is really important, because it's overwhelming. So I think that's about it. I'll just show real quick just kind of the Healthy Childcare Hour website and our map for consultants. So that's, I had mentioned that earlier. If you just go on our website and you can go on the consultant tab, or that's the direct link to the map. The contact information then is on the pages after the map, and that the emails and phone numbers for the nurse consultants are listed on that, as well as my information, and that's at the top of the page. So do we have any other questions? I didn't see any pop up.
No, I didn't see any more pop up in the box. Everybody was listening, because I think there's so much good information that you're sharing tonight. So maybe we'll just ask again if there's anybody who wants to type something in the chat, or if you want, we can unmute you and ask a question. And it doesn't have to be COVID related, even though that seems to be the hot topic right now. It could be anything health and safety. We've got Heidi here who could give us some really good answers and information.
I guess I'm curious, has anybody had any additional damage from your storm damage or with water issues. Maybe not, I hope.
I don't think so much around here. We didn't have any storm damage in the Northeast Iowa area too much. And it kind of felt like the rain that came last week was slow and steady. So hopefully,
So not too much.
Not too much.
Yeah, probably. I did hear, I mean, probably just south of your area, like south of Dubuque, I know had some issues. And Blackhawk County kind of area, I know there was some concerns kind of just south of there. I think it just depends on the part of the state, but I have kind of received information from several different areas of the state where they had concerns about storm damage.
Maybe something good to kind of touch on again, Heidi, is just the procedures on how to handle those soft items that, kids bring in the home, the blankets, the things.
Yeah, and this was a question actually that had come up earlier today, was, is it okay for children to bring kind of their backpacks? I know that we had talked about really, limiting soft items being brought into the environment. And we're still saying that because they're hard, to disinfect them. It's challenging. You can't really disinfect. Now, if they're bedding and things like that, we can wash and dry those, in the dryer. So that works. And I would just say for backpacks and things like that, if they have a separate space that they can put those in a cubby space or a separate location so that they're not touching other children's, backpacks and things from home, that would be best practice. I know that's sometimes more challenging, but if you have kind of a system in place, or if you don't have a system in place and you're thinking about like, how could I do this? I mean, even something as simple as, I've seen little baskets kind of lined up in the wall. And so each person has their own little basket and they put it in their basket, so I think that there are some ways to kind of work around that. And, you could use, some kind of, make it an art project and have them decorate their own box or something. And so that's their box where they put their items in with their backpack, or, we're going to get into coats and boots and all of that. And really, I don't know that that's much. I mean, we do have more of a concern because of COVID, but in general, we always say to try to separate kids' stuff as much as possible, just because it does help prevent the spread of even, other concerns or other situations. But in terms of cleaning and disinfecting, it's really hard to do those disinfecting of some of those soft surfaces. So limiting that if possible. I know that's hard for kids because they want to bring certain things with them to care, and we don't want kids to not have their comfort things either. But sometimes if you can ask parents, is there something else that they could bring that maybe would be something you could wash and either run through the dishwasher or use a disinfectant on, or a bleach water rinse, that might be an option that they could bring a toy like that from home.
How about those kids that maybe have a birthday coming up for a special occasion and families want to bring a treat? What would your comments be on that and how to address that with parents?
Well, I know in general, we kind of as part of our knapsack training is really to encourage to not do for like birthdays and celebrations, is to not make it around food and make it around other opportunities for activities or different special things that kids can bring to share. So I would say maybe starting with that. But if you are allowing treats to be brought in, really, we are saying best practice would be that they would be something that was purchased and sealed, like where they bought it from a store or whatever. Or if you had, like if a bakery made them and they were in a container, something like that. I know that has been a general recommendation, is to not have food coming from, that's homemade from homes.
So we have another question. Backpacks are an issue right now and challenging for those kiddos who are bringing those from schoolwork on those non-school days and lots of extra work. So I don't know, Joanne, if you had a question there, if backpacks itself are an issue, bringing those into the care, or just having the kids having extra work? So I don't know if any comments on it, having those extra backpacks. Or actually, maybe another comment too is maybe those kids that are maybe bringing iPads or electronics into the home. You know, how do you deal with that? And, you know, keeping those clean and safe. And
I do know the CDC does have specific cleaning stuff for electronics. Usually they say it's to not use chemical disinfectants on them because they'll wreck them. I really think that kind of having kids, you know, working at a table that you can disinfect. I mean, they could bring all their items, their iPad or whatever that they're working on, and they're sitting there and working on it. When they're done, they can put that away in their space, in their backpack, in their space, and then hand washing and then disinfecting the table before it's being used for another activity, I think is really clean, and disinfecting is kind of one of the best practices that you can follow with that, because, you know, that's just going to be a challenge that we have to work through. We have to kind of think through the process of what would be best to kind of prevent, you know, and we know, I mean, when you see any of the studies about how our cell phones, iPads, things that we touch frequently, and how many germs are on the surface, you know, and it is challenging because you don't want to wreck the screen on anything, you know, it's their property. But the CDC does have there is a disinfecting, or there's a general thing for electronics, so you might want to look at that on the CDC website. And that's under the cleaning and disinfecting link, and I think we have it directly on, if I remember correctly, it's either a link to the child care programs that remain open, and then if you click on that, it'll have a cleaning and disinfecting section, and it specifically addresses toys and electronics.
okay,
Questions?
thanks. And it is challenging with those kids. They have that extra work and trying to do that return to learn plan and bringing things home. And those are things that maybe you're having good discussions with your parents as well, you know, exactly what your expectations are and what you're going to allow. So we kind of encourage providers to have those conversations, and maybe even a policy around media and what support you can give. And I know in a previous communities of practice, we had Ryan Page on, I think from another region, and she, you know, was pretty clear in saying, from a DHS standpoint, we're not expecting providers to provide, you know, that extra, you know, support to families. You're there to care and supervise the children. So yeah, I know it's
I totally agree on that one. That's a lot for a provider to,
yeah,
you know. The other thing I would just suggest is, you know, while the weather is nice, if you can bring outdoor activities as an option, and even having kids bring schoolwork out, and, you know, put a blanket on the grass if it's nice, and have them bring their, you know, stuff outside to be able to kind of have some fresh air, and they can work on their, you know, their homework, or they can work on their, you know, their things that they need to work on, and you could maybe be doing story hour with some of the other kids. I mean, I think there's ways to kind of think about that. And then also right now, you know, maybe this is a good time to think about, how is my space laid out, and is there any changes that I could make to kind of create that smaller area where kids that need to be working on work could sit down and work. And I'm sure all of you have already done that, but if you haven't, and you haven't really thought about, okay, how can I go about this? I mean, really, you know, reach out to your CCR&R consultant, because they're great about that. They know your program, they know kind of your layout, and to be able to say, you know, have you ever thought about moving this out for right now? You know, maybe we don't need this extra piece of furniture in the room right now, and we're just gonna downsize a little bit in some of our furniture to kind of allow some more open space to kind of accommodate some of this, because that's probably the challenging part. And then I know one question we've had too about, like, for sleeping, and you know, we've always said with cribs and with spacing of cots is really, you know, we've always said 3 feet, because if kids are wearing masks, you know, they should technically, it should be 6 feet. Well, how can you 6 feet space? I mean, most people do not have that kind of room to be able to 6 feet space kids. But think about how your layout of your environment is, and then see, you know, how can you do some head to toe stuff so they're not facing each other. So if one child's coughing, they're not coughing. And then that's just general good cough etiquette this time of year. But really thinking about, can I be doing some, you know, head to toe spacing. Can I be spacing 3 feet plus head to toe? Because that'll give even more space between those kids. You know, can I rearrange my room a little different so that I've kind of got a group of kids on this area and a group of kids on the other side, and so I'm not having them all in the same location. And so some of those things, just kind of thinking about your layouts and how you can try to help with the spread of disease and keeping kids safe.
Well, thank you. Any more questions? I know it's getting almost to be 8 o'clock and people are thinking about checking out and ready to relax for the night. Just a few quick reminders. Don't forget, we've got those DHS monthly stipends available. If not us, but DHS does. So don't forget about those and submitting those stipends. Surveys to kind of get those in. This is, of course, recorded, so we will post this afterwards, and it'll be on our website and Facebook, so anybody who needs to go back and review it or share it with somebody else. We do have these communities of practice scheduled for October and November, so if you want to mark your calendars, we have one for October 6th, and then another one for November 17th. If you have any topics or information that you really would like to hear or share in these meetings, just please let us know. We really want to make sure these meetings cater to your needs and address the topics and information that you would like to hear. So don't forget also to check out those trainings on iPower. We've got lots of great trainings virtually that are happening. So if you have any training needs, we definitely can help you with that. If you have any further questions, make sure you reach out to your child care nurse consultant or CCR&R consultant, and we will definitely support you with what your needs are. Not seeing any more questions right now. So with that, I think we're going to say thank you very much for everybody attending. Heidi, thanks so much again for all the information you shared. Have a good night.
Yeah, you too. Thanks so much.
Yep, bye.